Okay, welcome back. This is Jessica Taddeo. I'm here with my patient. This is video number 3 for this week of the peripheral vascular. I'm going to just go ahead and practice some of the HEENT examination, and then we'll kind of move on from there and see how much time there's left after that. So I'm going to go ahead and greet my patient. Again. Hello, sir. Oh, wait, let me wash my hands, because I haven't done that yet.
Have you gone to the bathroom?
No. Still right here. Always wash your hands when you enter and exit. Hello, sir.
Hello.
My name is Jessica Taddeo. I'm the nurse practitioner student. I'm going to be doing an examination today of your head, eyes, ears, nose, and throat. Can you please tell me your first and last name?
Jeffrey Taddeo.
And your date of birth?
11/27/77.
Why do you keep giving me different birthdays? Apparently my patient's confused because he's giving me the wrong birthday. So, anyway, let's start with just general to start with any system. I mean, it's really quick, like when you actually do it in practice, but you're looking at your patient, looking at their grooming. Do they have any open wounds or any signs of distress, increased work of breathing? Are they dressed appropriately? Are they well groomed? Do they appear emaciated, or are they disheveled or dirty or smelly or anything like that? My patient appears well nourished, well groomed, appears a stated age, although he keeps giving himself a different age because he thinks he's funny. What else? No, and he's in no obvious signs of distress. I'm going to look at the head.
I'm dressed appropriate for the weather.
Yes, you're dressed appropriately for the weather. We're in Florida, so even though it's getting to be late fall, we can wear whatever we want. Anyway, looking at the head, I look with my eyes, not with my hands. I tell that to my children all the time. I'm just inspecting the skin of the scalp. I'm looking for any asymmetry. I'm looking at his facial features. They appear in normal position, and just the overall appearance. There's no signs of trauma. There's no bleeding. There's no bruising.
I have no hair.
Yeah.
So, being bald, the inspection of my scalp is relatively easy. Had I had hair, would you be going through my hair to check my scalp, or would it be a different?
I could just kind of part your hair a little bit and just kind of check the scalp and just make sure that there's nothing abnormal. I mean, yeah, you having no hair gives you a very easy way to look at your scalp, but also makes you more susceptible to skin cancer on your head and things like that.
But it makes me less susceptible to lice and stuff like that.
Hopefully.
Exactly.
No lice in this house.
I hope not.
So the head is normocephalic shaped normally, atraumatic. There's no signs of trauma. We can go ahead and move on to the eyes. I'm going to look at the external eyes. I'm looking at the orbits, the eyebrows, the eyelashes.
What's left of them?
Yes. The eyelashes. I'm looking at the sclera of his eyes. Yes, he's batting his baby blues at me. And then I'm looking at the conjunctiva for any pallor or any redness, any discharge from the eye. I'm also...
No contacts.
You don't wear contacts.
No.
Just looking at the overall appearance. Sometimes people have like a lazy eye, or they have like a visible cataract. I have an elderly dog. If you look at both his eyes, they're white and cloudy. He's got cataracts. My son has had an eye injury. He had a global rupture, a penetrating eye injury with a global rupture, and you can see he has an abnormally shaped pupil, and he's had cataract removal from that eye and a lens replacement. But you can, just by looking from the external eye, you can see that his pupils are abnormal. It doesn't constrict like the other one, and his visual.
To dilate him.
Yeah, he hates being dilated. Anyway, let's look at your eyes. I'm going to go ahead and check your pupils.
Now, with my eyes being blue, is it true or is it a urban myth that they're more sensitive to light than like someone with green or brown eyes?
I honestly have no idea.
Maybe something you should look into,
I'll have to look that up.
especially with that light that you
I
shine
know,
right in my
this
eye.
light is really bright. So ideally, I would shut the lights off in my examination room, and then I would just check his pupils. And if he was a compliant patient, he would hold still. All right. So what I'm checking is making sure that the pupils constrict, and when one constricts, the other constricts. So the pupils are equal, round, reactive to light and accommodation, and you want to estimate the size of the pupils. They're about 3 millimeters. And your pen light comes with a fancy little circles, just in case you don't know how to estimate millimeters. So I'm going to test for extraocular movements. I'm going to have you look at my pen, sir, and I know you hate this part. You're going to follow my pen with your eyes. And I can move this so we can see your eyes. Look into my eyes. Here, look at the camera. And we'll do it like this, okay? This way, backwards, down, up, and down, and then consensual, perfect. So I'm testing extraocular movements in the 6 cardinal fields of gaze. I'm gonna check peripheral vision. So go ahead and, let's see if I stand here. You're gonna look at my nose and keep your eyes on my nose. How many fingers do I have up?
2.
And how many fingers do I have up?
1.
How many fingers do I have up?
2.
And how many fingers do I have up?
3.
Okay, so checking, he's got good peripheral vision. I know sometimes patients tend to cheat and try to look over at where your fingers are, but you want to make sure that they're looking straight ahead. I'm going to check the optic disc and the fundus. Okay. So I'm going to check for the red reflex first. Just going to kind of shine here. Okay. Okay. I'm going to go ahead and kind of, I don't want like my face to get too close to his face when I do this, but you got to kind of,
Coronavirus.
yeah, right? I know, so skip this part. Coronavirus. Look inside and try to focus on the optic disc. And any patient with diabetes should be going to the ophthalmologist regularly for checkups on their eyes, which he does. It's always a good note for health promotion when you have your patients. When was your last eye exam? Just making sure that there's no problems with the retina and the vasculature in the eye. The next is the ears. I'm going to look at the external ears, the pinna, and just look at the external canal for any lesions, lumps, bumps, bruises, any drainage from the ear. You always want to check the skin of the ear too. Is kind of a spot that people can't see them on their own selves, and then they can be more susceptible to skin cancers and things like that back there. There's no drainage from the ear. Excuse me. I've been kind of struggling with a cold myself, so
Hopefully it's not coronavirus.
hopefully it's not coronavirus. I don't feel that sick though. Pardon me, sir.
Spreading your germs.
I should have a mask on. I'm going to take a look at the inside of his ear with my otoscope, and I want to examine the tympanic membrane, make sure it's intact, there's no sign of perforation. I'm looking for any redness or bulging, and then also examining the cone of light and all the internal structures, the malleus, the hammer. So for adults, you want to pull up and back and look inside the ear,
What about for children?
down.
What about for animals?
I've never looked at an animal's ear.
Might be something to investigate.
Yeah. So his ears are really weird because it's really red. At like, excuse me, at like 11 o'clock on the, if you look at the tympanic membrane like a clock, about 11 o'clock it's like red. But he's got scarring in his ears from multiple ear surgeries as a child. But the TM is intact, and besides that red part, it's pearly gray in color, and that's normal. He's got a little cerumen in there, but it's not impacted or anything like that.
Can you see where my tubes were when I was a kid?
No, they could fall out.
I mean, I know that, but I'm like, I wasn't sure if there was like scar tissue or something from
Well,
where
there's
they sat.
there's redness, like what this is what I was just saying, like, so there's redness like inside the ear, like it's like a line of redness. I mean, I don't know if that's, it's always looked like that. I don't know. I just assume it's scar tissue from all those surgeries, but I don't know for sure. The other ear, let's go ahead and look at that. Okay. Again, examining the external ear, looking for any drainage, lesions on the skin of the ear, and go ahead and take a look. Turn the light on first. Is always a
That might help.
always helps.
If you didn't have the light on, what would it look like?
Black. So I can see the TM, which is pearly gray, and again he's got redness on this side as well. And it's like bright red. One time I had taken him to the emergency room with a perforated eardrum, and I remember. Do you remember this doctor that I worked with, Dr. Inigas? He's like, look in his ear. He's like, this is not normal.
I was in Milford Hospital.
Yeah, it was in Milford Hospital.
After the hot dog safari.
That's correct. Yeah, he's had multiple perforated eardrums. It's gross. Like thick green pus comes out all over the pillow and everything. It's nasty. So we're pretty familiar with the ear problem. So ears, while we're on the ears, we can test for hearing. We can do the whisper test. The whisper test, I'm going to block one ear, and I'm going to whisper. What did I say, sir?
4, 5, 6.
Okay, I'm going to block the other ear. And I'm going to whisper something else.
Mama Kitty.
That's Mama Kitty.
My
There she
emotional support animal.
There she is. Fat cat. So I'm just testing just basic hearing. We can further assess hearing with my tuning fork. We can do the Weber and the, I gotta figure out how to say this. I am just gonna say Rhine, but I don't know if it's Rhine, Renee, Rin. Could we, how would you say it? R-I-N-N-E. Rhine. Okay. What did I say? Renee? I don't know. The Rhine. I go with the Rhine. So I got my tuning fork. What I'm going to do is I'm going to put the tuning fork on top of your head, and I want you to let me know if you hear it on both sides or just on one side.
Okay. I believe it's both sides.
Both sides. Good.
I believe so.
And now for the Rhine, Rennie test. This is going to test for the difference in bone conduction and air conduction of the vibrations. The Weber test tests for lateralization, and like if there's, say he doesn't hear anything on one side, but hearing on the other side, that would indicate hearing loss on this side. So for the next test, I'm going to strike the tuning fork. I'm going to place it over the mastoid process here behind his ear on the bone, and then you're going to hear the vibrations, and when the vibrations stop, please let me know, okay? And then I'll ask you another question. I'm going to strike the tuning fork. You hear the vibration? Tell me when it stops.
I think it stopped.
You hear anything?
Yep.
Okay. So air conduction should be longer than bone conduction. So that's normal. I'm going to go ahead and do the same thing on the other side. I'm going to strike my tuning fork. I'm going to place it on the mastoid process and just tell me when you stop hearing the vibration.
I don't hear anything.
You hear it now?
Yes.
Okay. Good. So air conduction is longer than bone conduction bilaterally. I'm going to look at his nose. I'm looking for any deformity of the external nose, any drainage, lumps, bumps, lesions, any obviously deviated septum. I'm going to tip your head back a little bit, sir. I'm going to look in the nostrils. And I'm going to use my otoscope. I'm going to look inside. And I'm looking at the turbinates of the nares. I'm looking for swelling, drainage, any bleeding, or anything like that. I'm going to look on both. Oh, sorry. Not in your mouth. You just got to be careful. You don't want to bump their nasal turbinates because you can make them bleed really easily. So it's got a little bit of drainage on this side. But the nasal mucosa are pink and intact, and the drainage is white.
A lot of boogers on that.
It's not really a booger, it's just like a snot. It's a
My cat
drainage.
is not amused.
It's mucus. It's mucus, nasal mucus. All right, I'm going to look at the mouth next. I'm going to look at the lips.
Hopefully it was a different one.
I'm going to use the same one. I'm not going to put it in your mouth. So...
Okay.
You want me to change it?
No.
It's not going to touch your mouth. I'm going to touch your ears and then
You
inside
don't
your
use it to
nose.
look at my rectum.
I hope not. Not for
Proctologist.
I'm definitely not studying to be a proctologist. Wait, close your mouth. I'm looking at the external mouth first. The lips are pink. There's no dry, cracked mucous membranes. I'm going to have you open your mouth.
Dry.
Yeah, but they're not dry and cracked. Say Okay, so I'm looking at the, when he says I'm looking at the uvula, should be midline, looking at the
That's
tonsils.
the little thing that hangs down.
Your little hangy ball, yeah.
Is that what causes brain freeze when you drink slushes too fast?
I have no idea.
Another thing you should look into.
You ask all the hard questions. I don't have any idea. I think it's from the soft palate on the top of your mouth, honestly.
Getting too cold.
Yeah, because, like if somebody said that if you put your tongue like on the roof of your mouth and then you hold it there, I think your tongue is warm and it warms up that soft palate. But I'm going to look into that and I'll get you the right answer. I'm not sure.
I like slushies.
I'm not a brain freeze expert. Okay. Looking at the tonsils, he doesn't have any tonsils, so there's nothing to look at back there. But if he did have tonsils, if they were swollen or red, or if there's any exudate, I would want to note that and note how swollen are the tonsils. And it's like +1, +2, +3, +4, 1 being the least, 4 being the greatest, 4, the tonsils are like touching. And then also noting if sometimes if you have like a peritonsillar abscess or something, you'll have like unilateral tonsillar swelling. And then I'm also looking at the buccal mucosa. Open your mouth again. I'm looking on the inside of the mouth and the tongue. He's got a little hairy tongue, like it's a little brown in the back there. Can you see it? So there's really nothing to do for that. I tell him to brush his tongue more. What?
Like that?
You don't need to see that. What do you do? Yeah, you can see the hairy tongue without that. You just see it with your eyes. I'm only using this for the light. I'm not like looking in it or anything. That's why I'm in school and you're not. Oh my God, you make me laugh and lose my train of thought.
You were telling him about my hairy tongue.
Yes, hairy
I need
tongue.
to brush the back of my tongue.
You need to brush the back of your tongue.
Correct.
So I'm looking at the teeth. He's got a couple cavities, a few missing teeth that have occurred along the way, but no current problems with his teeth.
You're not a dentist.
And I'm not a dentist, but I could tell if you have like a abscess in your gums or something like that, or a broken tooth. Beyond that,
You don't have any broken teeth.
you need to see a dentist.
Correct.
If I had a tongue depressor, I could check his gag reflex. I don't have a tongue depressor, so I'll just simulate with my finger, and I would stick this in the back of his throat. Say, "Oh, I'm gonna do it over here," and just kind of press the tongue depressor on the back of his throat, and he should gag.
I mean, I just watched you cough in your hand.
I washed my hands like 5 times.
Not since you coughed in it.
I wasn't gonna stick my finger in your mouth anyway. Try biting. Anyway, I'm gonna check the lymph nodes. Sit forward for me. Okay. So I want to palpate the lymph nodes for any tenderness, swelling, any if they're movable or non-movable. So in front of the ears here, I'm gonna turn your head. This would be the pre-auricular. And then behind the ear would be the posterior auricular. Occipital is going to be along the back of the skull here. Tonsillar is going to be right in the throat here.
When you don't have tonsils anymore, do you still feel for it?
Well, I'm feeling your lymph nodes.
Okay.
I'm not feeling your tonsils.
This is what you check for like strep throat, right?
Well, I'm just checking your lymph nodes.
Okay.
But yeah, you usually will have swollen lymph nodes and strep throat. So tonsillar, submandibular should be under the mandible bone here. Submental is going to be under the tip here of the chin. The superficial cervical. The posterior cervical, and then the deep cervical chain is hard to feel sometimes.
I don't know what's going on, but the table's moving. Must be your foot. Wanted to make sure the cat wasn't.
Yeah, I think I was sliding on the floor. And then the supraclavicular above the clavicle. So I want to feel for all those lymph nodes.
Everything feels okay?
Yes.
That's good.
Also,
That one hurts.
Where?
Well, when you push on this one, it hurts for some reason.
I'm going to check axillary lymph nodes. And then oops, your elbow here. The epitrochlear lymph nodes. I never felt these in anybody, but they're over here. Right there. I could check for inguinal lymph nodes. There's horizontal and vertical inguinal lymph nodes. And then I want to palpate your thyroid gland. I'm going to go behind you here. Okay.
Better get a pretty big office once you become a nurse practitioner.
Climb with my patient. So I'm going to have you just sort of hyperextend your neck, and I'm going to feel down, feel for the thyroid cartilage right there. And then you can feel over to the side. And that is where the thyroid is. Go ahead and swallow again if you could. Good. So I don't feel any masses or any lumps or any like super hardness or anything in the thyroid gland. If you feel mine, I have a nodule right here on my thyroid, and you can feel it. That concludes the head, eyes, ears, nose, and throat examination. I didn't check his visual acuity. I didn't have my little piece of paper, but that would
Yes,
be
you is right there.
Oh,
We still have like another 3 minutes to make your hour,
Let me
so
grab
let's
that
do
piece
it.
of paper.
You're the doctor.
That means I have to move. How does comfort?
Ow!
No. Okay. So let me check visual acuity. This would be part of the eye exam. So we want to hold that about 14 inches away from your eyes. Go ahead and read to me.
Now, what in the hell is that last number? That's always bothered me since we started doing this.
It should be 428739, right? Or you mean underneath that?
The
I have
very
no idea.
bottom
It's a
one.
copy, so it's probably not that good.
It's 4 2. I still can't see it even with this thing. I think it's 8.
Yeah, it's 428739.
4 2 8 7 3 9. Okay, ready?
Yeah, but you just memorized it. It's hard to. It's a little hard because it's
Well,
a
I'll
copy.
just go with the 2020. 937 826.
Okay, right eye only
937 826.
and left eye only.
Oh, gotta give it a minute, yeah. 937 826.
Okay.
It's 2025.
2025 in both eyes, left eye and right eye. O-S and O-D. All right, so my patient here is awake, alert, oriented, appears as stated age, dressed appropriately for the weather,
Pink skin.
well groomed, well nourished, skin is pink, warm, and dry. His head is normocephalic, atraumatic, eyes, sclera are white, conjunctiva are pink. There's no obvious drainage or edema to the eyes. Their extraocular movements are intact. Pupils are equal, round, and reactive to light at 3 millimeters. His ears, the TMs are intact. No signs of erythema or perforation. There's no drainage from the external ears. The nose is nasal mucosa is pink. Some slight drainage in the right nair. There's no lesions or anything noted. The mouth is mucous membranes are pink and moist. Some poor dentition, no tonsils, no tonsillar swelling, a little bit of a brown discoloration to the posterior tongue, and lymph nodes are non-tender to palpation in preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical,
No, this one kind of hurt when you pushed on it.
supraclavicular, superficial, posterior, superficial cervical, posterior cervical, deep cervical chain. I knew I missed one. And supraclavicular. He had a little bit of tenderness over the right supraclavicular area, but there's no swelling there. Like I think maybe his bones are tender or something.
It hurts again when you did it. Feels like you're pushing on a bruise or something.
Yeah, it's not a lymph node. There's no swelling in the axillary, epitrochlear, or inguinal lymph nodes either. Gag reflex is intact. Thyroid gland is soft, non-tender, without any masses or nodules noted. So
And we did my eye test.
Oh, and visual acuity. Thank you. Such a good patient. Visual acuity is 2025 bilateral eyes, OU, 2025 OS, 2025 OD.
Probably would be better if it wasn't a copy. It's so hard to see that bottom line.
I wasn't going to buy one. I just made a copy. It's fine for practicing. That concludes the... Oh, no, I forgot to say one thing. Hearing is intact bilaterally per the Whisper test. There's no lateralization per the Weber test, and Rhine test reveals air conduction is greater than bone conduction. So that officially concludes the video for today. Do you have any questions, sir? Any more questions?
No.
You'll come up with some. I'll get back to you about your.
You just
your
need to get a
questions.
better thermometer.
What's wrong with my thermometer?
I just don't feel like it's accurate. I don't think my temperature's 97.3.
What do you think your temperature is?
Isn't like the average temperature 98.5?
Listen, they scan our
That's
head.
like 1.2 below the average.
It's fine.
Okay.
If Avery has a fever, it detects it.
You hope.
Well, I think it does. It's better than those guns that they check our temperatures with every day when I walk into work. 94.2. Yes. Good to know. All right. Thank you so much. Have a wonderful day. Thank you, patient. And we'll see you next week.